So good day. We'll be discussing about hyperthyroidism. I will be presenting first slide to sixth slide. So hyperthyroidism. What is hyperthyroidism? This is sometimes called an overactive thyroid. It is when your thyroid glands makes more thyroid hormones than what your body needs. Your thyroid is a small butterfly-shaped gland in front of your neck. It makes hormones that control the way in the body that our body uses our energy. So how do we know that a patient or an individual has a hyperthyroidism? It is through showing of signs and symptoms. So we have the symptoms here presented as they have fatigue, weight loss, sensitivity to cold, depression, memory problems, greater hair loss, muscle pain, trembling of hands, and infertility. The thyroid gland facilitates normal growth and maturation by maintaining a level of metabolism in the tissues that is optimal for their normal function. We have the two major thyroid hormones, that's T3 and T4. T3 is a triiodothyronine, and we have the most active form of thyroid hormones, the thyroxine, which is T4. So the function of this thyroid is to control the thyroid stimulating hormone, which we call the TSH, the thyrotropin, so which is synthesized by the anterior pituitary gland. So it acts as to mediated by CAMS and leads to stimulation of iodide substance. So both T4 and T3 are absorbed after oral administration. So this is the mechanism of action of drugs or what we call the anti-thyroid drugs. So in short illustration, we have here the mechanism of action of anti-thyroid glands. It is the presentation that these drugs binds to the thyroid enzyme, which we call the thyroid peroxidase, and prevent oxidation of iodide or iodotyrosyl residues. Thereby, it inhibits iodination of tyrosine residues in the thyroglobulin. It also inhibits coupling of iodotyrosine residues to T4 and T3. Also, the thyroid colloid is depleted after overtime, and blood levels of thyroid hormones are progressively lowered as it showed in this illustration. So, in additional mechanism of action of this type of drug, for propylthiouracil, it inhibits peripheral conversion of T4 to T3 by B1. So we have here the samples of drugs for hyperthyroidism. We have propylthiouracil and methimazole, which belongs to the thioamide substance that inhibit hormone synthesis. The next one, we have the K1 and Logo solution that belongs to iodide salts that blocks hormone release. So we have ipodate that belongs to iodinated contrast media for the inhibition of peripheral T4 to T3 conversion, and it also inhibits the hormone release. So we have anion inhibitors that covers perchlorate and thiocyanate that block the uptake of iodide by thyroid. And the next one, we have I31, which is the radioactive iodine that for the destruction of thyroid tissue. And the last one, we have the use of beta blockers. Example is propanolol and esmolol that controls heart rate. The concept of hyperthyroidism is the uptake by the thyroid gland, which we have the oxidation to iodine by a peroxidase enzyme, the iodination of tyrosine on the thyroglobulin gland, and we have the condensation of 2-diiodotyrosine residues that gives rise to T4, whereas condensation of iodothyroxine residues with diiodothyroxine residue at T3. The hormones are released with the following proteolytic cleavage of the thyroglobulin that proceeds to deiodination is a major route of metabolism of T3 and T4. Also, it undergoes sequential deiodination. So the hormones are also metabolized via conjugation with glucocoronides and sulfates and excreted lastly into the bile. So the excess secretion of thyroid, lastly, which we call the hyperthyroidism or the excess thyroid release of hormones can cause tachycardia in the cardiovascular system that affects very rare and cardiac arrhythmias in body wasting, and we have nervousness, the tremor, and heat tolerance. T3 and T4 is bound to thyroxine binding globulin in plasma. T4 is enzymatically deionated to T3, which enters the nucleus and attaches to the specific binding receptors. So the activation of these receptors promotes of RNA and subsequent protein synthesis, which is responsible for the effects of T4.
So, good day. I am Jonna Marie Baksarpa. I'm here to continue to tackle about hyperthyroidism, and I'm going to talk about thyroid and anti-thyroid drugs. So, metimazole. Metimazole inhibit both oxidative process required for iodination of thyroxyl groups and condensation of iodotyrosine to form T3 and T4. It has lower incidence of adverse effect. Contraindication of metimazole is contraindicated if there is hypersensitivity to the drug or any of its components. Profyltyracil. It blocks the peripheral conversion of T3 and T4. Its adverse effects, its teratogenic effects, hepatotoxicity, agranulocytosis. Contraindication, it has if previous history of hypersensitivity to PTU or any of its component drugs. Iodide, its mechanism of action inhibits the release of thyroid hormones from thyroglobulin by mechanism not yet understood. Adverse effects, sore mouth and throat, swelling of the tongue or larynx, rashes, ulceration of mucous membranes, metallic taste in the mouth. Contraindication, previous history of hypersensitivity to PTU or any components of drugs. So thyroid gland secretes thyroid hormones. Tetraiodothyronine or T4 or thyroxine, it is the principal hormone, increases energy and protein metabolism rate. Triiodothyronine or T3 increases energy and protein metabolism rate. Calcitonin regulates calcium metabolism, works with parathyroid hormone and vitamin D. So here is the figure of thyroid hormone synthesis. So thyroid hormone synthesis requires a variety of molecules in the thyroid follicular cells, including sodium iodide, symporter or NIS, which transports iodide into the cells, and thyroperoxidase or TPO, which oxidizes the iodide into iodinum that in turn into iodinates thyroglobulin. Deiodination. So deiodination is basically the removal of iodine from a compound as a thyroid hormone. So the iodinase is expressed in peripheral tissues, remove iodine from thyroids converting T4 to T3 and important action in increasing hormone potency and for the removing iodine to inactivate the hormones completely.
At Bixisanas, I'm the last one to report about hyperthyroidism. So this is the pathways of thyroid hormone metabolism. So thyroid metabolism has different pathways. We have glucuronidation, sulfation, and deionation, the latter being is the most important. The three enzyme catalyzing deionation have been identified, called type 1 or the D1, type 2 the D2, and type 3, which is the T3 or the iodothyronine deionase. The regulation of thyroid hormone secretion. So TSH is a glycoprotein secreted by the basophilic tryptotrophs and is regulated by negative feedback of thyroid hormones. So, example, the higher the serum of the levels of the hormones, the lower the TSH release and vice versa, and the stimulation from TRH. So, thyroid hormones mechanism action. It acts as binding to specific nuclear thyroid hormone receptors or the TR, and T3 has a 15-fold higher binding affinity for TRs than the T4 has. The hormone receptor complex binds to DNA via zinc fingers and increases or decreases the expression of the variety of different genes that code for proteins that regulate cell functions. So in humans, there are two TR genes, which is the alpha and the beta. By alternative splicing, each forms at least two different of mRNAs and therefore two different receptors protein. So the thyroid hormone action, which is growth and development, thermogenic effects, cardiac stimulations, metabolic, which increase LDL receptors expressions or insulin resistant state. Thank you.